This is Jeremy with Chiropractic Clarity, and in this video, we're going to be going over the bony features of the femur. To start, we have the femoral head. The femoral head is what's going to articulate with the acetabulum of the hemipelvis, forming a ball and socket type synovial diarthrodial joint. Furthermore, around the center mass of this femoral head, we have what's known as the fovea for the ligament of the head of the femur, also known as fovea capitis, which is going to serve as an important attachment site for the foveal ligament of the head of the femur, also known as ligamentum capitis femoris, ligamentum teres of the femur, or the round ligament of the femur. And this is going to transmit the foveal artery. The foveal artery is a branch of the obturator artery, which, if we remember correctly, sits within the superlateral aspect of the obturator foramen, within the obturator canal, thanks to the obturator membrane. So whenever the obturator artery exits the obturator canal and gives off the foveal artery, that is going to run within the foveal ligament of the head of the femur in the acetabular notch, or the acetabular foramen, when completed by the transverse acetabular ligament, towards the fovea capitis of the femur to perfuse the femoral head. Furthermore, we have the femoral neck. The femoral neck is a lot easier to distinguish than the humeral neck, not only because there is only one here, whereas there was two of the humerus, but because this is a clear demarcation between the femoral head and diaphysis. On the posterior aspect of the femur, we have the greater and lesser trochanters. The lesser trochanter is an important attachment site for the iliopsoas muscle, which is made up of the iliacus and psoas major muscles. And in between the greater and lesser trochanters, we have an intertrochanteric crest, the crest between two trochanters. And this is on the posterior aspect of the femur, whereas on the anterior aspect of the femur, we have an intertrochanteric line, a line between two trochanters. Furthermore, on the posterior aspect of the femur, inferior to the greater trochanter, we have a gluteotuberosity, and inferior to the lesser trochanter, we have a pectineal line of the femur, not to be confused with the pectineal line of the pubic bone, also known as pecten pubis. And the way I remember the orientation of these bony landmarks is that I associate the G's, greater trochanter and gluteotuberosity. The gluteotuberosity combines with the pectineal line of the femur to form linea aspera, which is an important attachment site for various muscles of the thigh. Furthermore, on the distal posterior aspect of the femur, we have a medial and lateral condyle. And these are going to help orient the name of the next two bony landmarks, our medial and lateral epicondyles, as well as our medial and lateral supracondylar ridges, which are kind of analogous to those same bony landmarks of the humerus. In between the medial and lateral epicondyles, we have a fossa. Therefore, this is known as the intercondylar fossa, the fossa between two condyles. And there's one more bony projection off the medial aspect of the femur that we must note, which is the adductor tubercle. And the adductor tubercle serves as an important attachment site for the adductor magnus hamstring portion of that muscle. And that concludes the bony features of the femur.